When you open your eyes in the morning and the first thing you notice is that your mouth feels like sandpaper, like every drop of moisture has been completely erased overnight, most people reach for a glass of water, assume they didn't drink enough the evening before, and think nothing more of it. But I need you to sit with this for a moment, because what I'm about to share with you has the potential to change the way you think about your health in a very fundamental way. That parched, papery feeling when you wake up is one of the most underestimated warning signals the human body produces, and in adults over the age of 60, it is almost never simply about thirst. I've spent over a decade working directly with older adults in clinical settings, and the number of patients I've sat with who had been silently waking up dry-mouthed every single morning for months, sometimes years, without ever being told what it could mean, is something I find genuinely difficult to accept. I'm DoctorLeana, and today I want to walk you through 7 of the real, documented reasons this is happening to you, starting with the most manageable and ending with the one that concerns me most as a clinician, because that final cause is almost certainly something you are encountering every single day and have never once been warned about. Before we go further, I want to ask you one honest question. How long has this been happening to you? Is it recent, or has it been going on so long that you've simply stopped noticing it? Drop your answer in the comments because I genuinely read them, and what you share helps other people watching this feel less alone. Let's start with something that nearly everyone underestimates. As we age past 60, saliva production naturally decreases by somewhere between 30 and 40% compared to earlier decades of life. That alone creates a baseline vulnerability. But saliva is not just moisture. It is a highly complex biological fluid that contains protective enzymes, immune proteins, and minerals that actively defend your mouth, your throat, your digestion, and your overall immune function around the clock. When saliva production drops, your first line of defense weakens, and the research on what happens next is sobering. Adults over 60 with chronic dry mouth face a nearly 45% higher risk of systemic infection because bacteria, fungi, and viruses that would normally be neutralized by saliva now have a direct and unobstructed path into the body. So let's go through all 7 causes in order, because by the time we reach the one I want you to pay the most attention to, you'll understand exactly why I feel so strongly about getting this information to you. The 7th cause is one that almost everyone encounters, but far fewer people take seriously enough. Breathing through your mouth while you sleep. I know what you're thinking. That sounds simple, almost too basic to matter. But here is what I need you to understand. Mouth breathing during sleep is almost never just a habit. In the vast majority of cases I see, it is a symptom being driven by something else entirely, whether that is nasal congestion, structural narrowing of the nasal passage, the presence of nasal polyps, or most significantly, sleep apnea. When air moves across the tongue and palate all night long, it evaporates moisture at a rate your sleeping salivary glands simply cannot replace. You wake up with that raw, thick, cottony feeling, sometimes a sore throat, cracked lips, a coated tongue. But the dry mouth is not the real concern. Sleep apnea is. Research consistently links untreated sleep apnea to a 60% increased risk of stroke and a 40% elevated risk of heart failure. If you snore, if you wake up feeling exhausted despite a full night of sleep, or if anyone who shares a sleeping space with you has ever noticed you briefly stopping breathing during the night, please treat that as a medical conversation worth having, not a quirk to file away. For those whose nighttime mouth breathing is not tied to sleep apnea, some practical changes make a measurable difference. A nasal strip applied across the bridge of the nose encourages nasal airflow throughout the night. Running a bedroom humidifier between 40 and 50% humidity significantly reduces the rate at which moisture evaporates from your mouth and airways. Sleeping on your side rather than your back reduces the tendency to drop the jaw and breathe orally. And a small strip of medical-grade tape applied vertically over the lips before sleep, a technique used by sleep specialists for years, gently redirects breathing back through the nose. Many people notice a real improvement within days. The 6th cause is one that feels like the right solution, but is actually working against you in ways most people don't realize. If you're like the majority of people who wake up dry every morning, you've almost certainly tried drinking a large glass of water right before bed. It feels logical, it feels proactive, and then you wake up just as dry as before, possibly even more frustrated because you did everything you could think of and it still didn't work. Here is the physiological truth. Drinking water does not hydrate your tissues in real time. After you swallow, it takes anywhere from 30 minutes to 2 full hours for that fluid to be absorbed, distributed through the bloodstream, and made available for biological functions, including saliva production. Water consumed at 10 at night is offering almost nothing to your mouth at 6 the following morning. The window has long passed. What the research actually shows is that adults over 60 who didn't maintain consistent fluid intake during the midday and early afternoon hours were 62% more likely to experience significant overnight dryness compared to those who stayed hydrated steadily across the day. The fix is not more water at night. It's earlier water, distributed through the afternoon. Aim for 6 to 8 ounces with each meal and any afternoon snack. And here is one practical tip worth trying. Add a small pinch of sea salt and a squeeze of fresh lemon to your afternoon glass. That combination supports electrolyte balance in a way that helps your cells actually hold on to hydration rather than excreting it rapidly. The fifth cause is one that surprises almost everyone, because we rarely make the connection between what we eat and how our mouths feel when we wake up. Your salivary glands are not passive structures sitting quietly in your jaw. They are metabolically active tissues that depend on specific nutrients to function at the cellular level. 2 deficiencies in particular devastate salivary gland output in adults over 60 faster than almost anything else I see. The first is vitamin A. This nutrient is the structural foundation of every mucous membrane in your body, including the lining of your mouth, throat, nasal passages, and digestive tract. When vitamin A levels fall, those membranes become progressively thinner, drier, and less functional. Research has documented that adults over 60 with inadequate vitamin A showed a 41% reduction in baseline saliva production compared to those with sufficient levels. That is not a modest effect. That is the difference between a functioning system and one running at less than half its natural capacity. The second group is the B vitamins, specifically niacin, also called B3, and B12. Niacin disrupts the nerve signaling that triggers saliva release in the first place. B12 deficiency causes the tongue to become inflamed, abnormally smooth, and persistently dry, a condition called glossitis that no amount of hydration fully resolves because the problem is not water intake, it is cellular function. After 60, the ability to absorb B12 from food declines meaningfully due to reduced stomach acid production, and research suggests that up to 30% of older adults have inadequate B12 levels without any awareness of it at all. For dietary sources, sweet potatoes, dark leafy greens, and eggs provide vitamin A, while lean meats, fish, and dairy support B12. Many adults over 60 also need supplementation. Look for a B-complex formula with at least 1,000 micrograms of B12 in methylcobalamin form, which is the most readily absorbed version available. One additional tip worth knowing. Vitamin A is fat-soluble, meaning it absorbs significantly better when consumed alongside a small amount of healthy fat. A drizzle of olive oil or a few slices of avocado alongside your meal is not a small detail. It genuinely changes how much of that nutrient your body is able to use. The fourth cause is the pairing that I take most seriously in my clinical work, and I want you to hear this not with alarm, but with the kind of clear-eyed attention that actually changes outcomes. If you are waking up with a dry mouth and you are also getting up to use the bathroom more than once during the night, those 2 symptoms together are a clinical warning sign I never dismiss. That combination is among the earliest observable signals of uncontrolled blood sugar and, in a significant number of cases, undiagnosed type 2 diabetes. Here is the mechanism. When blood sugar rises past a certain threshold, the kidneys respond by working intensively to filter and excrete the excess glucose from the bloodstream. That process requires drawing water from the body's own tissues, creating an internal dehydration that you feel most acutely overnight when you have no ability to compensate by drinking. And what makes this so important is the timeline involved. Research found that morning dry mouth was reported by 63% of adults at the time of their type 2 diabetes diagnosis, and that most of those individuals had been experiencing that symptom for well over a year before they were ever tested. Over a year of their body communicating something was wrong every single morning. I think of a patient I cared for, a sharp and active woman in her early 70s who came to see me about something unrelated. As she was gathering her things to leave, she mentioned, almost as a footnote, that she'd been waking up dry-mouthed for as long as she could remember. I asked her a few targeted questions. Was she rising at night to urinate? Yes, regularly. Was she experiencing unusual fatigue in the afternoons? Yes, she was. I ordered a fasting blood glucose panel that same week. Her result came back at 148 milligrams per deciliter. She had type 2 diabetes and had been living with it unknowingly for well over a year. Within 4 months of targeted dietary adjustments, consistent daily movement, and supplementation with berberine and magnesium glycinate, her fasting glucose had normalized. She told me at her follow-up appointment, "I finally feel like my body is on my side again." That is what early detection looks like. Not a crisis, an opportunity. The third cause is one that affects an estimated 4 million Americans, and yet the average person waits nearly 3 years from the moment their symptoms begin to the moment they receive the correct diagnosis. 3 years. That is not a gap in medical science. That is a gap in the conversations happening in examination rooms every single day. The condition is called Sjogren's syndrome. It is an autoimmune disorder in which the immune system mistakenly targets the body's own moisture-producing glands, primarily the salivary glands and the tear glands. The result is persistent dry mouth, chronic dry eyes, difficulty swallowing, and, in more advanced presentations, systemic involvement that can reach the joints, the kidneys, and the lungs. Women over 60 make up approximately 90% of diagnosed cases, which makes this a particularly important conversation for that group. The reason it takes so long to identify is that each symptom tends to get addressed in isolation. The dry mouth is attributed to dehydration or aging. The dry eyes are blamed on screen time or seasonal allergies. The joint pain is labeled as routine arthritis. No single provider connects the picture, and the underlying autoimmune process continues the entire time. The diagnostic clue I want you to carry with you is this. If your dry mouth is consistently accompanied by eyes that feel dry, gritty, or burning, and especially if you are a woman over 60, please ask your doctor specifically about Sjogren's syndrome by name. A blood test measuring 2 specific antibodies, anti-SSA and anti-SSB, can identify the condition in most cases, and you are entirely within your rights to request that test without waiting for someone to offer it. There is no cure, but there are effective management strategies that significantly reduce symptoms and slow progression. And for immediate day-to-day relief while you pursue answers, sugar-free gum containing xylitol is one of the most accessible tools available without a prescription. It stimulates saliva production while simultaneously inhibiting the decay-causing bacteria that an unprotected dry mouth encourages to grow. The second cause is one that almost no one connects to a dry mouth, and yet the link is not only real, but documented in peer-reviewed research that I believe every adult over 60 deserves access to. Your salivary glands do not operate on their own. They are regulated by the autonomic nervous system, specifically the parasympathetic branch, which governs the body's rest, recovery, and digestive states. When that system becomes disrupted or begins to dysfunction, salivary activity declines. The mouth dries. What makes this clinically significant is that autonomic nervous system dysfunction is a documented early feature of both Parkinson's disease and Lewy body dementia. And research has shown that these autonomic changes can precede the motor symptoms that typically prompt a diagnosis by 4 to 6 years. I think of a patient, a retired man in his late 70s, measured and observant, who had mentioned a persistent dry mouth across several visits. We had worked through the obvious explanations together: medications, sleep position, hydration patterns. Nothing fully resolved it. Then, during one appointment, his wife mentioned almost incidentally that he had stopped recognizing the smell of his morning coffee. He had noticed it too, but hadn't brought it up, assuming it was irrelevant. It was not irrelevant. I referred him to a neurologist. Imaging confirmed early-stage Parkinson's disease. He was understandably shaken, but because we identified it early, he was able to begin neuroprotective care and put a thoughtful plan in place well before significant motor symptoms developed. 3 years later, his quality of life remains genuinely good. He told me at a recent visit, "I almost didn't mention the dry mouth. I figured it was too minor to bring up." Nothing is too minor to bring up. Your body is always speaking. The work is learning how to hear it. And now, the first cause. The one I see most often, the one most poorly communicated, and the one I feel most strongly deserves a direct and honest conversation. More than 500 commonly prescribed medications list dry mouth as a documented side effect. More than 500. For adults over 60 who typically take an average of 5 or more prescription medications daily, the combined impact on salivary function and on broader neurological health can be profound. The drug classes most frequently responsible include antihistamines, antidepressants, blood pressure medications, bladder control medications, antipsychotics, and certain pain medications, including muscle relaxants. What elevates this beyond inconvenience is a concept called anticholinergic burden. This refers to the cumulative neurological effect of taking multiple medications that block acetylcholine, one of the brain's most essential neurotransmitters. High anticholinergic burden has been linked in multiple large studies to accelerated cognitive decline and a significantly elevated risk of dementia. The dry mouth is not the endpoint. It is the visible, surface-level signal of something occurring at a much deeper level. I think of a patient, a retired man in his mid-70s, who described waking every morning feeling as though he had swallowed chalk. He had been on the same medication combination for years. No single prescribing physician had ever reviewed the full list in a single sitting. A medication reconciliation appointment revealed 2 drugs with overlapping anticholinergic properties, both of which had safer alternatives available. We made 2 substitutions. Within weeks, he noticed the difference. Within 2 months, he told me, "I wake up feeling like myself again, and my thinking feels clearer than it has in years." That was not coincidence. So here is your action plan starting tonight. If you currently use an over-the-counter sleep aid containing diphenhydramine, stop tonight. Melatonin at 0.5 to 1 milligram is a far gentler and safer alternative for most people. Run a bedroom humidifier at 40 to 50% humidity. Move your hydration efforts to the afternoon rather than the evening. Brush with a fluoride toothpaste specifically formulated for dry mouth before bed, and try a nasal strip. Then, this week, write down every single medication and supplement you take and bring that complete list to your next appointment. Ask your doctor directly whether any of those medications suppress saliva production and whether any safer alternatives exist. You are not broken. Your information has simply been incomplete. And that ends right now. If this helped you today, please like this video and subscribe for more real health information built specifically for adults over 60. And share this with someone who wakes up dry every morning and has never once been told why. Leave your thoughts in the comments. Which of these 7 causes made you stop and think, "That could be me"? I want to hear your story, because aging does not take away your body's capacity to heal and recover. It simply asks you to pay closer attention.